Hi, I'm Dr. Sandra Lora Cremers, and I want to talk today about the dangers of doing a lot of near work, especially without taking breaks. And when I say near work, I mean computers, laptops, iPhone, iPad, but even reading. So without taking breaks can be dangerous. And it's controversial because we were taught in the past that it wasn't dangerous for the eyes, but now we know that's not true. It is dangerous, and I'll tell the two reasons why. The first reason is that doing a lot of excessive near work can actually make the eyeball grow. And I learned this an interesting way when I was at Harvard Medical School. My sister, who was pre-med, came to do a rotation with us, and I checked her vision, and she was plano, had needed no glasses for distance or reading. And that was great, so she went to medical school and studied her butt off. And after a year, she came back, did another rotation with us, and she was saying she couldn't see the board as well as she used to. And I was like, oh, it can't be anything because you're over 21. And so we were always taught that if you're over 21, you cannot make the eyeball grow. It's done growing. Well, that wasn't true. She came back and she was a -2. She needed to get prescription glasses to be able to see well for the distance. And that meant that she had myopia. And myopia means that the eyeball is longer than the average eye. So her eyeball had grown a little fraction of a millimeter, but had grown enough that she noticed the need for glasses. And it wasn't a high prescription, but it taught me a lesson that doing a lot of excessive near work, and that's what she was doing, studying very hard, made her eyeball grow. If you take a child or teenager or young adult and do the same thing, they can grow even faster, and that can cause problems. It can cause something called high myopia, which usually means you're more than -5 in terms of prescription. Now it's become an international epidemic, and what that means is that when you have a longer than normal eyeball, it stretches the retina, which is the inner film inside the eye that gives you the ability to see the colors and everything else around you. That increases your risk of developing a hole, a tear, something called a posterior vitreous detachment, which means you see flashing lights or floaters because the gelatin inside the eye forms clumps and it can pull on the retina and can pull the retina off. It also increases your risk of damage to the optic nerve called glaucoma. So we know myopia increases those risks: retinal detachment, hole, tear, posterior vitreous detachment, glaucoma, also cataracts. One of the newer things we're realizing, it is also causing terrible dry eyes, and that's the surface of the eye. So we now know when people when they stare, they don't blink as much as they should. When they're focusing, whether they're reading or doing something on their iPhone or driving or skiing, they don't blink as often. That's a well-known fact. What's happening now to a lot of people is that when they don't blink, they're losing their meibomian glands, these hidden structures inside every eyelid. At the base of the eyelash is a gland that produces oil, and that prevents your eye from feeling pain. It's like a cushion. It's also like it provides part of the tear, which is like a pair of glasses. So when people lose that gland, it can lead to chronic pain, chronic blurriness, redness, reflex tearing, chronic dry eye. And we have a name called computer vision syndrome, but it's much more than that. It can be debilitating pain. So we really do not want people to stare. We want people to take breaks. We want people to take breaks when they're reading at the computer. There's now apps on your phone that remind you to blink, because every time you blink, you literally pull a little bit of oil out of the gland, so it'll come into your tear film to make the tear film more stable. When we don't blink, then the tear film is unstable, the oil doesn't come out, and it can make the gland dry up, which can lead to a chronically unstable tear film, which can mean chronic pain and chronic poor quality vision. So we know now that blinking, not doing too much near work or taking breaks, because it's very difficult obviously not to do a lot of near work these days, but taking breaks, blinking fully, reminding yourself to look away will prevent these dangers of a lot of near work. And I'll mention some studies. There's a lot of studies now that are available on PubMed and online. There's one particular one that came from China last year that changed the policy of China. So for years, the Chinese students have always worked about 12 hours a day, doing a lot of intense reading, a lot of intense computer, learning as much as they can. And last year, they looked at their rates of myopia, retinal detachment, glaucoma, cataract in young people, and they found they had a huge epidemic on their hands. And the president of China essentially put in a law requiring all students to go outside for 1 hour a day. That's the first time in history, because they're trying to break the cycle of myopia. Now, 1 hour a day probably is not going to cut it, but maybe it'll make an impact, and it will remind people to really go outside, look around, play. We know children that play outdoors have less myopia and less of those other problems I mentioned than those students that are indoors quite often and studying all the time. So anyway, if you have any questions, let me know. I'll post more information on my blog, which is idoc2020 at blogspot.com. Thank you.